Hey, it's Rachel with Drug Free Birth, and I just got off the phone with a very nice couple, and I wanted to talk about it because they told me their birth story from their first child, and it is really indicative of why people are choosing natural childbirth these days. So, this particular mom, she was talking to me about her first birth experience, which was within these last 2, 3, 4 years, and in a different state. And this really informed why they are now looking for maybe more options, more education, more knowledge on childbirth, more advocacy skills because they really want to see a different outcome. Now, they have a really cute child at home, and their baby, now toddler, is nice and healthy, and they're very grateful for that. But they also want things to go a little bit differently this time. So, let me describe to you how this parent's birth went. Um, and hopefully, this will explain a little bit about why it's so important to get educated on childbirth in general. So we know what rights we have, we know what options we have, we know what to talk to our doctors about, and we know how to advocate for ourselves and our spouses in hospital or doctor situations. So this mother said that her water broke about the middle of the night, and she really didn't start pushing, which was in the hospital, until about 24 hours later. Now, in a lot of books that you read, you will see that childbirth can be up to about 24 hours. And so this was really textbook for her. Now, she was already in the hospital during much of this time. And so if you choose a natural childbirth, you may be coached to wait at home a little bit longer, communicate with your doctor by phone, but maybe do a lot of those early hours on your own at home. She mentioned that they went to the hospital right away. So, right when that water broke, they went to the hospital. Now, a lot of times, a natural childbirth coach is going to recommend that you do talk to your doctor, that you do monitor things, and that you do create a plan with your doctor should the water break early. But at the same time, she was just told, hey, just get over here right now, just rush over. So they were really in the hospital about 24 hours. Lots of time to be poked and prodded by their healthcare professionals in the hospital. Another thing that she mentioned that was a little bit tough for me to hear was that she was told that she had to give birth on her back. And just comfort wise, she felt that she really wanted to be on her side instead. And if you've been reading about natural childbirth, you'll know probably that being on your side can really give a lot of relief, a lot of comfort. Baby can come a little bit maybe faster that way. Pushing is maybe more relieving when you're maybe on your side or in a different position. Being flat on your back does offer restrictions, although it's the best view for the doctors for sure. But instead of allowing her to maybe flip to her side, she said that the nurses actually held her legs down. And I just honestly, I just wanted to cry hearing that. So she was told emphatically that she may not flip over. Um, with this, maybe because of this, in conjunction with this, she was also told that her birth wasn't progressing, that she in her labor was not progressing. Therefore, they needed to give her something to speed that up, to get those contractions going, maybe longer, stronger, maybe more frequently. So she was given some Pitocin because of that. Um, Doctors also ended up using vacuum for baby, which we have learned that could be avoided, maybe with the conversations prior to, maybe with getting into different positions, maybe allowing mom to be a little bit more on her own time and to feel the sensations that she needs to know when it's time to push, or maybe when it's time to change positions. Also, she was given an epidural. And I know that's a very personal decision, but by the time she had gotten her epidural all the way through when it was time to start pushing, it had worn off for her. So it really did not offer her the relief that she was hoping that she would get. during the most intense portion of childbirth, which is pushing. Um, so she's very grateful that she has a nice healthy baby and that she is pregnant again, and she's very grateful for that. But at the same time, she says, you know what, she used a couple of descriptive words. She said, you know what, can we just go maybe at a more natural perspective for this second child? And I am all for it. I'm here to support her for that, or point her in the right direction if she's looking for specific resources. But I just want to say that it's kind of the name of the game when it comes to childbirth these days. A lot of things are becoming standard, or at least very frequently practiced, that aren't always medically indicated. One more thing that I almost forgot to mention was the cord clamping and the cord cutting. She had actually brought this up with her doctor in clinic before baby came, that she had read that maybe waiting to delay that cord cutting would be their preference. And the doctor actually said, well, maybe we can wait 30 seconds. But that's all I'll give you. And this poor mom, she had already done some research and was forming some opinions, and she kind of got shot down by her doctor. Now, of course, I wasn't there, and this is years ago. So there's no way for me to know exactly for sure, what her doctor maybe mentioned word for word, but I am encouraging my clients to have these conversations early. And then if a doctor is saying, well, because of statistics or because we're noticing that maybe this procedure might be better than that procedure, or maybe we need this certain treatment rather than no treatment, for example. I am encouraging my clients to get more information, to ask, was there a specific study or studies that have indicated that now we need to move in this particular direction? Or is this just anecdotal? Or is this something that we can negotiate on? Maybe can we find a time frame that maybe meets in the middle for this? So we want to do a delicate dance with our providers. Certainly, they've been to medical school, and the majority of us have not. But that doesn't mean we can't be good advocates for ourselves and always ask questions, ask for more information, ask for time to decide, get second opinions, ask maybe what would be the repercussions or the treatments that I may need after this particular treatment or procedure. So I just wanted to mention that because we're seeing this all the time from parents who are telling us about maybe their previous experiences or what they're noticing in conversations. And we really want to just encourage parents to ask lots of questions, get give time to themselves to give informed consent. And I think the key word there is informed. Okay. So thank you so much for tuning in, and let's keep the conversation going. Reach out to me with any questions. And happy parenting out there. So thanks so much.